All right, welcome to this webinar of natural ways to heal your pain. I'm really excited for us to take a look at pain in probably a little bit of a different way and to help encourage you to feel empowered to make healing more of an inside job rather than an outside job. I'm Dr. Lindsay Trotty. I am a doctor of acupuncture and Chinese medicine. I've been working to help people out of pain for the past 15 years. I started as a personal trainer and then decided to go to school to become an acupuncturist. During school, I worked as a massage therapist and worked in a variety of different clinics, all focused on different aspects of pain. Some in direct pain management, sports medicine, oncology, pediatrics. I've worked with prenatal and postnatal patients and people with autoimmune disorders. So I have a pretty good understanding of pain in its various forms. I opened my clinic Level Acupuncture in 2021, and most patients come to me for pain relief. So my hope for today is that I can help reach patients and practitioners and change the way that we are taught to think about pain and modify how we approach pain. So today we're going to be talking all about pain, our ideas and beliefs around pain, how can we heal ourselves, and when must we seek care. So this webinar series I started with pain. It's the first thing most people come in for in my clinic. They start with pain. Pain is a huge industry in this country. In 2016, it was estimated that in the US alone, $500 billion was spent on pain. And in 2008, it was estimated that the average patient, aside from their basic healthcare needs, spent an additional $4,500 on pain each year, with low back pain and neck pain being the most common types of pain that people will seek treatment for. And in my 15 years of helping people get out of pain, I have observed some things that will help bring people long-term relief. And that is going to be the way you think about pain, the practices you have in your day-to-day life. And so I hope in this talk, I'm going to help change your mind about it and will help you with your mindset. And that should help you change how you live with pain more than any other treatment any kind of doctor can provide. So before we get into it, I really want to talk about placebo. So placebo has been often associated with sham medicine. Placebo is kind of a dirty word in the medical community. Research studies are set up so that they're comparing a drug, a therapy, a surgery versus placebo. So placebo being the inert substance or practice without any supposed causal effect, but you'll still see results. So what that looks like is, say they're testing a new drug for headaches. They have one group of patients take the drug for headaches, observe them, have one group take a pill they think is the drug for headaches and observe them. And for the drug to be deemed a success, it has to outperform placebo. So these people are getting better even with placebo, but nobody is really asking the question in these trials, well, why and how are they getting better? Why is it important? Because they're really looking to see if this drug is going to work and it can be marketable. It has to outperform placebo, but what is placebo doing? Well, placebo is essentially the belief that you will heal. And that's a very powerful concept. If we believe that we can heal, if we think that something is going to work, and then we experience relief, well, then is that really sham medicine? So I challenge you to think about, if you're feeling better, isn't that cause for celebration? Wouldn't you deem that a success? So there are different ways that we would perceive pain based on your understanding of medicine and where you're coming from. In the biomedical or Western medical model, pain is usually classified as a nervous system response to trauma, injury, inflammation, or chemical imbalances. In the biomedical model, we're going to take things down to the microscopic level. We're going to try to refine, and look for a single cause and then treat it specifically when it comes to pain. Alternatively, in the traditional Chinese medical model, is that there is more of a holistic approach to pain. They're looking at bigger systems. In traditional Chinese medicine, there is what's called a meridian system, and it's connecting parts of the whole body. You can see these lines on this model. Those are some of the meridians. And there's a famous saying in Chinese medicine, 不通则通，通则不通, which basically translates to, if there's free flow, there's no pain. If there's no pain, if there is pain, there's a lack of free flow. And I always give the image to my patients that pain or problems in the body are like if you have a garden hose that someone didn't put away correctly the last time they used it. That garden hose might be all over the yard with a bunch of bends and kinks. And when you go to turn on the water pressure, that water might stop at a kink, and the pressure might be enough to open it up. However, you might come across an area that is really congested where there's a lot of bends and kinks, and you'll have a pressure buildup, and that's pain. So pain is the signal that there's not a free flow. And so it takes some kind of practitioner, some kind of treatment to open up that area again. And then the water, the circulation can go through and you no longer have pain. So this is the idea that we use in Chinese medicine, specifically acupuncture. Now, there's also a metaphysical viewpoint, or what is becoming known as quantum medicine. And it's this idea that everything on the metaphysical plane has a manifestation in the physical. And to put that simply, this is what we would call the mind-body-soul connection, or mind-body-spirit connection. And it's not necessarily on its own. There are people in the biomedical world who follow this, and there are people in traditional Chinese medicine that understand this as well. So this looks like, if you're in the biomedical world and you have fibromyalgia, one way they might treat your fibromyalgia is with antidepressants. So they have found that people with fibromyalgia often respond to antidepressants because there is a mental emotional connection to their physiological pain. In traditional Chinese medicine, we categorize things in meridian systems. We categorize things in an idea called the 5 elements. And that is associating physical parts of the body with these mental, emotional experiences. So for example, the lung meridian comes through the shoulder here. And the emotion associated with the lung is grief or sadness. And I have seen patients who have lingering shoulder pain, who have gone through a lot of therapy, have done all the right things. They cannot find a discernible physiological cause like a tear or dislocation to say this is why this is not getting better. And then we do some digging and realize they might have some unresolved grief, unresolved sadness. And once we address that, their shoulder gets better. So how would patients perceive pain? This is important because how you perceive pain will give us some ideas about what the expectations are going forward when you start to feel relief. So I try to identify my patients' beliefs when they first come in. There are patients who come in who subscribe to the belief that there's no pain, no gain. This is the person who is going to push themselves harder and will take pain as a feedback that they're doing something right, that they're going to get stronger. And to a certain point, yes, this will help you if you can be comfortable with discomfort. If you can challenge yourself, yes, you will get stronger. The muscles do have to break down and have little micro tears before they have hypertrophy or growth. And so that can be a little bit painful. That can be what we call DOMS, or delayed onset muscle soreness. However, if you are a professional baseball pitcher and you're throwing over and over and over again, and you're starting to feel pain in the shoulder, well, that's not something to ignore. You're not going to get a stronger arm or a faster arm if you're starting to wear and tear at the ligaments and tendons of the shoulder. So understanding that not always pain is a sign of strength and growth is important. Next, we have patients who might have high tolerance for pain. These are the people who grin and bear it. These are the patients who wait until their pain is severe. They're maybe at an 8, 9, 10 before they actually have to stop and ask for help. And these patients are probably the hardest to treat because it takes that really high level of pain to slow them down. And they're very, very comfortable with their discomfort. And these people will come in with a 9 out of 10 pain, and we might get them down to a 5. So they're still in a considerable amount of pain, but they're comfortable with that 5 out of 10 pain. And then they might stop treatment because treatment slows them down. Having to come in and nap for an hour is a waste of time in their perception. And so they will get a little bit of relief, a little bit of healing, and then go back to doing the things they've always done and will not show up again until their pain is high. So these patients can be really tough to treat if they're not going to change their minds about pain. Alternatively, people with low tolerance will not endure any discomfort. So these are the patients who might be fairly sedentary, and part of what's making them sedentary is also causing pain. So they're just sitting too long. They're not moving their muscles. They're not being active, and they're getting achiness. They're putting on pressure on their joints. So when they have to get up to just maybe make some food or do some laundry, it's uncomfortable because they're not used to moving. And then they'll take the first sign of discomfort as, well, this is too painful. This is too much. I quit. I don't do anything. So these patients can also be tough to treat. They're generally not as hard as the high tolerance pain person, but this is something to identify in yourself or in your patients if they're high tolerance or low tolerance. Really, you want to have somewhere in the middle. Okay, somewhere where you're going to listen to your pain enough to make changes, and somewhere where you're going to have enough understanding that discomfort in the short term will lead to long-term progress. And these low tolerance pain patients might even be the type of people who identify with their pain. Okay, the high tolerance are going to ignore their pain. The low tolerance are going to identify with their pain. And these are the people who label themselves with a condition. They'll say things like, I'm arthritic, or they'll make excuses for why they can and can't do things because of their pain. So this is the patient who comes in and maybe they have back pain, but they tell me, I also have knee pain, but don't bother working on my knees because the doctor says it's arthritis and there's nothing to do about it. Okay, well, already this is going to be a problem, because if this person doesn't believe that arthritis can be healed, then they're going to accept that level of discomfort in their knee And they might not also work to improving their overall function of their body, their overall posture, their overall movement. That would include their knee, that will ultimately have a benefit for their back pain. So it's important to know that whatever condition you have, there is generally going to be some degree at which you can change how you live your life that is going to promote healing of that condition. So again, how you perceive pain dictates how you will heal. There's two basic camps that patients will fall into. One is thinking of pain as an annoyance that must be eradicated. I have this pain, it just needs to go away. I just don't want this pain. So when we come to pain with this idea, we're probably going to look for the quick fixes. We're going to look to any pill, any surgery, any treatment to just make the pain go away. But we're missing an opportunity when we hold this belief, because pain is purposeful and it's giving you information about what's going on in the body. And when you have this belief about pain, this perspective about pain, you're going to have a more holistic approach to healing your pain. You're going to start actually listening to your body's underlying needs, and working towards correcting those imbalances. So, for example, the person who has the pain that's annoyance just wants to be eradicated, they're the person who is probably going to take a lot of pain pills. They're going to take these pills every day to mask the pain and not change the way they move. So they're just going to further complicate the problem. And then they're going to need higher doses, or they're going to need other procedures, because they've exhibited so much wear and tear on their joints, maybe, that now there's no elasticity, there's losing synovial fluid, the cushions in the joints, and now they need surgery. Okay. Instead, if they actually listened to their pain and said, hey, what can I do to change what I'm doing, instead of just getting rid of their pain, they could avoid all of these bigger procedures. So this brings me to a concept of root versus branch. This is very fundamental in traditional Chinese medicine, but this concept is not unique to traditional Chinese medicine. It's just gotten lost in the biomedical model and through practice for a lot of these doctors. And it's this idea that a lot of the symptoms that people will complain about, the ones that get their attentions, are not the full problem. They are branches of a bigger system, and there are roots that to this problem that need to be addressed. Otherwise, if you know anything about gardening, if you don't pull out from the root, this thing can just grow back. So this is fundamental. Okay. So when you understand root versus branch and you apply it to your daily life, I'm not saying you're going to have a pain-free life, because that's impossible. Anybody who says they can cure you from pain is a charlatan. Okay. However, you can be free from a life of ongoing pain, because at the source, you can stop things before they become so severe it inhibits your day-to-day life. So what would root versus branch look like? It could be the person who has back pain that's getting very severe, and they've tried a lot of treatments. They've tried heat and massage and pain pills and physical therapy, and the back pain will get a little better, but keep coming back. And what could be going on is perhaps they are chronically constipated. The constipation is going to cause inflammation in the intestines. It's going to have a pressure buildup that will push out. You only have so much space in there. It's going to push out on the muscles, the nerves. It's going to change the way you're walking. And so that back pain will keep coming back if the constipation isn't addressed. Okay, so when I have patients come into the office, one thing that I bring up is, why do you want to get out of pain? Because this is going to help me assess what this patient's commitment is going to be to changing their life outside of my clinic. I can do a lot for people for their pain. I can help them a lot with acupuncture, with direct treatment. I can walk them through stretches. I can stretch them myself. I can use cupping. I can use a number of things, give them herbs. But if they're not going to take on the responsibility of changing their lifestyle to change how they are going to approach pain as it comes up, then they're going to be dependent on me, or they're going to be dependent on any kind of medical treatment for the rest of their lives. So the first thing that we look at is, how is pain right now affecting your daily life? Are you losing sleep? Are you having trouble digesting your food? Is your pain affecting your ability to have relationships with people? Is it making you so grumpy you can't connect with people? Or is your pain keeping you from going out and socializing? Is it keeping you from work? Is it keeping you from being able to exercise? I want to know what it's doing to inhibit your life in the moment. But even more importantly, I want to know, how will your life be better without pain? So when you're out of this pain, what are you going to do? What is your life going to look like? And this is where patients often get hung up. They don't have a vision for what they want their life to be when they're out of pain. And this is very important, because if you don't have a vision of where you want to go, you're not going to get there. Right? It's like Alice in Wonderland when she asked the Cheshire Cat, which way do I go? And he says, well, where do you want to go? And she goes, I don't know. And he goes, well, then it doesn't matter which way you go, right? If you don't know where you want to be, if you don't know the kind of life you want to have, then it makes it very hard for whichever practitioner you're working with to help you get there. And it's very hard for you to know when you're getting better. So the third thing is, it's very important to be realistic about what you're willing to change. There are a lot of strategies that will help you to change your life for the good. And it's important for me to assess with a patient, how much are they willing to change? For some people, they're going to need baby steps, and that's fine. It's just knowing what you are capable of. This might be the difference of, let's say we're talking about diet and exercise. If I know that a total overhaul on a patient's diet will, of course, help them, but if they're not going to do it, then what good is it for me to even suggest it? Because if I say you have to do this big overhaul or else, well, the patient's just going to give up and not get there. Sometimes we need small steps for us to get there. It might be just, okay, you need to start drinking a little more water. And that's something they can manage. And generally, when people are in a lot of pain, they can only do so much to change. It's as they get out of pain that we start introducing more things about changing your lifestyle that will help you from getting back into that high state of pain again. So you're probably pretty familiar with these strategies for pain management. Generally you're going to go to your PCP and they're going to send you off to different specialists who are going to look for different drugs or procedures that you can do. There's very little emphasis in biomedicine and the insurance biomedicine model on actual patient education. You might have heard from your doctor that, well, you'd have less pain if you lost weight, and then actually not get any strategies on how to do that. So these are some of the things that the biomedical model can help you with. All of these things can work for you. All of these things can be a part of your pain relief. But again, unless you have a plan and you know what to expect from these treatments and then what you can do to help get the most out of these treatments, then these procedures might just be Band-Aids. In traditional Chinese medicine, we have other strategies. So a lot of times when you go to work with an acupuncturist, you might think that you're only going to get needles, and that is a big barrier of entry for people to go to see an acupuncturist. They're afraid of needles, and they don't want to get needles because they're in pain, and needles sound like more pain. So they won't come in. But I cannot tell you how many times, even the patients who get acupuncture who have been really nervous will tell me, I wish I had started this sooner. But if you are really too nervous to get acupuncture, many acupuncturists, doctors of Chinese medicine, have a lot of their modalities at their disposal that can help you, like herbal medicine, Tuina, which is like a type of massage, cupping, gua sha, moxibustion, all of these things. So these are a lot of practices I employ in my private practice, but they are accessible nationwide at this point. And some metaphysical strategies for pain relief would be working with someone who's like a Reiki practitioner, energy healer. Some people do plant medicine, or certain therapists will do things that will tap into subconscious beliefs and emotional work. Even prayer. Prayer has been shown to help with a lot of health conditions. So, you know, if you're religious and that's part of your spiritual belief, then that is something you can employ. And there's a lot of emerging evidence that working on with the metaphysical modalities and making that part of your pain relief is very effective and really complementary to all the other things I've already discussed. So again, when you're thinking about your pain, you really want to assess your own pain. You can do your own intake on yourself. I give my patients a very expensive intake, almost to the annoyance of many of them, but it's for a purpose. I want them to fill out as much as possible because I really want them to think about their full life. I want them to get thinking about what has been going on in their body, what have they been experiencing, and I want to see what's going on, because I don't think pain happens in a vacuum. Like we talked about the root and the branch. So you can do your own intake on yourself. This is a really good mindfulness practice. Assess your pain level, assess the frequency of your pain. When is it happening? Is it happening in the morning? Is it happening in the afternoon? Is it happening after a specific activity? You can think about, what is the quality of the pain? Is it dull aching? Is it sharp shooting? Do you feel nauseous when you get pain? Do you have pain in your elbow and then it shoots down into your fingers? Okay. So really understanding your pain and thinking about it is going to get you on track to finding good solutions for it. And another thing that's really important to assess is, how quickly are you expecting results? If you have a chronic condition and you come into my office or any healthcare practitioner's office and expect for your 20-year sciatica pain to go away in a week, well, that's kind of an unrealistic expectation, because it took a long time and a lot of effort for you to get to that level of pain. And it's going to take some time for your body to heal, right? There's no instant gratification. Now, will you get some relief in your pain if you come into my office today? Probably. I aim to see about 50% reduction of symptoms while in the treatment room. How long it's going to last, I don't know. Everyone's different. Generally, if you're going to work with me, I expect to see a level of pain relief while you're in the treatment room. It might get up by the time you get to your car. Some people might feel relief for 1 to 3 days. And that's why I have them come in very frequently in the beginning, because we're looking to see that that frequency and duration of pain is going to come down. But it will take some time for it get to such a low level that you don't really need me anymore, and you're moving on to these, depending on these lifestyle modifications to keep you out of pain. Okay, if you have acute pain, Don't wait, address it right away. Acute pain can be fixed so much more quickly. I had a patient whose daughter was having severe jaw pain, and she thought, okay, I should get in to see a dentist. She couldn't get in to see a dentist. She was thinking about taking her to the ER. And she called me and she says, is there anything you can do? And I asked some basic questions just to make sure this really didn't sound like an emergency situation over the phone. And I said, okay, come into my office. She just started feeling it maybe hours before, but it was very intense. So once I assessed that this was not an emergency situation, I decided to treat her. And within that treatment, her pain went down from a 10 to a 2. And then that was it. We did one more follow-up and she never had it again. So when you have acute pain, don't ignore it. Seek help right away or start helping yourself right away. Also assess, do you have comorbidities? Okay. Are you going to be a fast healer? What are things that are going to get away of your healing? If you're not sleeping, it's hard for you to heal. If you have a pre-existing condition like diabetes, or if you've been diagnosed with chronic fatigue syndrome, or if you have emphysema, you're probably not going to be a fast healer for pain. Your body is going to put more energy into those internal organ systems than it is going to put into your elbow. You can live without your arm. You can't live without your lungs. So really take that into consideration when you're starting any kind of treatment for your pain. And your healthcare provider should give you some realistic expectations. It's very important that when you're working with a doctor or healthcare practitioner, that they have given you this information at that first. If they aren't giving you these expectations for care, then they're probably not going to be the right fit. This idea of informed consent is also very important, and this often gets overlooked. So what informed consent means is that every time you decide to start a new therapy, to start a new treatment, get surgery, your doctor, your healthcare provider should go over all the risks associated with that treatment so that you understand the risk before you start, any potential side effects for you to look out for. The same thing goes with understanding what a treatment plan is going to look like. How long should you commit to this? How frequently you should be coming in? If you can't commit to a full treatment plan, managing expectations for what the relief is going to look like. So for example, my high tolerance people who get down from 8 out of 10 to 4 out of 10 pain, I tell them, if you quit now, if you stop coming in at 4 out of 10 pain, guaranteed you'll be back into my office in a couple of weeks or months because we didn't finish this complete treatment plan. And so they know they can make that decision for themselves. But I always want to educate them so they have all the information. And it is also a patient's responsibility to ask for this information, especially if you're going to a PCP or any kind of doctor who works in the insurance model. They are incentivized to have quick appointments. So if you don't ask, they won't answer. Okay, so where do we start at home with home care for pain relief? There are some basic things. One of my favorite authors, Gretchen Rubin, she writes about happiness and habit formation. She says, what you do every day matters more than what you do once in a while. So part of these concepts can be directly affected by pain, but they can also be the source of why your pain isn't healing. Okay, so starting with, how do you move? Okay, one of the first things I have my patients learn how to do is how to sit and stand. We really go over how to change that. So as you can see how I'm sitting in this video, I have my shoulders stacked over my hips. My knees are stacked over my ankles. My head is not too far forward, it is rotated. And it looks like really good posture, right? So when we address our sitting posture, we're addressing a lot of the reasons for why our pain is not going away. We are in a society where a lot of us sit majority of the time. We're sitting to eat, we're sitting at work, we're sitting in our car, driving around. So once you have learned how to sit appropriately, you're going to take away a lot of aggravation for your pain. And I have a video on YouTube. I will share that with everybody, and you can start practicing today. And it is also very telling once I cue my patients into sitting like this, if they have any trouble getting into this position, it gives me a lot more information about the muscles that are imbalanced and working to rectify that. So the second thing is going to be how you stand. So inevitably, almost all of my patients stand with their feet way too close together. Their feet are close together. They might be with their toes turned out. Their knees are locked. And to help balance them out in this posture, they probably have their neck too far forward. So I give them the image of Superman. Superman is got a wide stance. He's taking up a lot of space to show his authority. His feet are wide. He has quite a bit of space between his knees. His knees have a slight bend because he's always ready to jump into action. And his shoulders are broad and open. His chest is lifted. So a lot of times when people think about opening their chest, they'll pull their elbows forward and they'll actually mimic like a chicken. And when they do this, their neck and their head are going to go forward too. And that's going to create a lot of pressure on the neck and shoulders. We always give the image of your neck being like your wrist and your head being a bowling ball. And so when you hold a bowling ball, you want to have this extension through your neck. So you want to have this curve. You don't want to hold a bowling ball like this. It's going to be too heavy, and that's going to really hurt your arm and your fingers. So important in long-term pain relief is your posture. The third thing, once we've mastered sitting and standing, is balance. Can you balance on one leg? Can you shift your balance easily? Because this is real core strength. Okay, doing crunches is not going to give you core strength. It might make you have nice abs to look at, but they do nothing for your actual stability. And even walking is a balance exercise. We go on one foot to the other. So if you have instability in one of your legs, then that is going to put an uneven amount of pressure, and you're going to keep having that pain come back over and over. Okay. When we talk about how to move, the things that I really want to emphasize with my patients is that you should train for how you live. You should be practicing movements that are going to mimic your daily life. So if you have a dog, you want to be able to have that core strength when you walk your dog, that if they tug you, they're not going to pull your shoulder. Okay. You want to be able to know how to keep your shoulder tucked in toward the back, not too tight, but so that you have flexibility if there's a little tug. If you have to pick up groceries, you want to know how to squat down or bend down and lift without putting too much pressure on your low back. If you have grandchildren or children or little kids that you love and you want to pick them up and throw them, then these are the kinds of movements you want to get strong through. Not just in the chest and arms, but in your lower body for stability, so that when they come down, or if anyone knows kids, they jump on you unexpectedly, that it's not going to totally injure you. Okay. You see these people in the picture, they're stretching, they're just holding it right now. So that's called static stretching. Static stretching is fine, but it's part of your cool down. This is a very important concept that my patients usually haven't heard of, but you need to start a warm up before doing anything with dynamic stretching. So what that's going to look like is they're doing this motion, but they're tilting and then coming back to center, tilting, coming back to center over and over again to get circulation through their body. So this also is part of yin yang movement. We do a warm up because we're starting from a yin state, a rested state. Okay, the yin yang is that black and white circle with the two little balls in it. Yin being restful, passive movement, and yang being more active, more energetic movement. So if we're at rest, we're in a yin state. We start warming up with dynamic stretching, so we get more yang movement, and then we do our full workout, like a run or HIIT exercise that's ultimate yang. And then we want to come back down with a cool down. So that's when we would do our static stretching. Okay, so we want that dynamic flow of energy, and we want to bring that into how we move day to day. And it's important to scale your activities. No professional athlete does full training at 100% every day, all day. You want to find the good balance of doing enough to get you moving and then having enough rest time. And like I mentioned before, you want to identify the difference between DOMS versus pain so that you actually get some results. Okay, so sleep is very important. And unfortunately, most patients don't really make this connection. They kind of know sleep is important, but it's also been normalized in our culture that we probably just won't have good sleep. Well, if you're not having good sleep, you're not going to heal. So the quality and quantity is important. And a lot of my patients will notice that as they're starting to heal, they'll probably get improved sleep before they get overall pain relief. But aside from the quality and quantity of sleep, we also have to talk about sleeping positions. So in this picture, this woman is my patient who has sharp shooting pain or numbness in her finger. She's got sharp shooting pain coming through her neck and shoulder down to her elbow. So what you can see in this picture is she has her shoulders rounded. She has her shoulder closed in and her elbow bent, and she has her wrists bent and she has pressure on them. So all through every joint, shoulder, elbow, wrist, she has what we call closed pack position of the joint, which means it has less openness for nerve circulation, blood circulation to come through. And if you sleep like that all night, then you are going to compound your pain. She's also a very smaller woman, and it looks like a pretty big pillow. So she's probably pushed up. Her jaw looks like it's pretty close to her shoulder, which means there's probably quite a big bend in her neck. And the older we get, the less flexible and pliable we are. That's going to create a lot of neck pain, contribute to the shoulder pain, maybe even give her headaches. Also, when you sleep on your side, just like how her shoulders are coming in, her hips are doing the same thing. She's getting an increased what we call Q angle, which means that the angle from the hip to the knees is more severe. Again, not enough circulation down to the lower extremities and a lot more pressure on the joints in the low back and the pelvis. So one solution that I tell my patients is, number one, try to sleep on your back. If you have trouble breathing, then you might want to prop yourself up in a reclined position. You're probably going to want to prop up your hands a bit. So they, depending on your body type, they're not behind you, because again, that's closing the shoulder. And you might need a little pillow under your knees. But if you can't sleep on your back and you prefer to sleep on your side, then you're going to need to get some pillow support. I recommend getting a pillow under your arm that you can hug. Again, that's going to open up the joints. It's going to create more space in the shoulder, elbow, wrist, and getting a pillow between your legs. Now, for most of us, we're going to need a king size pillow, because what we want is we want support from our hip creases all the way down to our ankles. We don't want to have our feet sickling in, because again, that's going to create congestion through the joints. So how do you know you have enough sleep? Do you have energy in the morning? Okay. Is sleep hurting your pain? Well, do you have more or less pain in the morning? If you have more pain in the morning, something you're doing while you're sleeping is aggravating your pain. It needs to be addressed. If you have less pain, then you probably have an overuse injury. You're doing too much during the day, and it's a signal you need to rest more. And then one last thing, become a sun worshiper. I'm not going to go into too much of this detail, but if you really want to reset your whole body, get up with the sunrise, go outside, don't look at the sun or in that direction through any window, don't have glasses on or contacts, go outside, observe the light coming from the east for 5 to 15 minutes every day. Okay, that's going to help reset a lot of systems. How we eat is very important, but this is going beyond just losing weight. Okay, we want to look at these ideas of what is healthy food, how does it serve us, and even more importantly is what does mealtime look like for you? In this picture, you can see that this meal looks pretty good. It looks fairly well balanced. The juice is probably not necessary. Sugar juices are going to definitely increase inflammation. But the real problem is it seems like this person is very concerned with eating quickly, and they're also distracted by their phone. They're scrolling. So in Chinese medicine, we say that you have these organ systems that are responsible for digesting information. So digesting the information of the food you eat to metabolize and to make into energy sources, but also digesting the information that comes in through media, through talking to friends, through reading, through learning. They're the same system. And we might not be very efficient multitaskers. So if you are taking in too much information by watching videos on your phone or eating during a meeting, then not enough energy is going to go toward digestion and metabolism, and that is going to affect your overall energy and ability to heal. So here are some lab values that will kind of tell if your metabolism is working well or not. And this is something that we can all fix with different types of medicine, but they're definitely going to want to be addressed if you're looking for long-term pain relief. And the last one, a DEXA scan, is something that I'm starting to really recommend to all patients because it's a very good way to know your fat distribution, which fat is stored energy. And it's good to know your bone density. So that's something I can talk more about later. DEXA scans are usually reserved for older women who have a family history of osteoporosis. But I think that anyone, even starting in your 20s, can go get 1 to 2 DEXA scans a year to make sure you're on the right track. And then following it up every 5 to 10 years. Okay. So in Chinese medicine, we talk a lot about the temperature of food and classifying food according to the 5 elements. And what this means is that there is no healthy diet. There's no one healthy food. You have to look at your condition a little bit more holistically and a little bit more dynamically. If you have a hot condition, you probably don't necessarily want hot food. You probably want to balance it with some neutral or cooling food, and vice versa. If you are having pain in the summer or you're in the summer, then you might want to modify your food to summer appropriate foods. Okay. You also are going to want to know your constitution. We have different ways of saying in Chinese medicine what a person's constitution is. Bodsa is one way to find out what your constitution is. And generally that's going to tell us what your body is going to respond to better. And then also we have seasons of life. Children are in a different season than when we're in our 70s. And so we're going to need different foods at that time. We're going to be able to tolerate different types of diets at different stages of life. So it's a more nuanced thing than, okay, lettuce is good for you or lettuce is bad for you. Salads are good, salads are bad. It's not about what's good or bad. It's about what's appropriate at this time. And this would probably be a much longer lecture, but just understanding that this is a concept that exists and it does affect pain is important. And of course, please drink water. If you think you're drinking enough water, check your pee. If it's clear, then you need electrolytes because that means the water is not getting into the cells. And then with water, please try for room temperature or warm water. Cold water is going to cause constriction. And constriction, a lot of times, is what creates more pain. Muscle constriction, vessel constriction, nerve constriction. We don't necessarily want that. It's very rare that we have pain from dilation. It can happen, but most people's pain is from too much constriction. Okay, so here are some examples of how we use the 5 elements in traditional Chinese medicine, what the flavors look like, what parts of the body they're associated with, the colors of the food might be associated with these elements, and then what they look like when they are in balance. When you're eating these foods and it's in balance, this is the effect. And then what will happen if you eat too much of this? So sweet foods are probably the most obvious we can identify. If you're eating the right amount of sweet food, it's going to nourish you. You're going to feel good. Okay. We need carbohydrates for energy. But if you're eating them in excess, then you're going to have a buildup of flesh. Why? Because if you're eating in excess of carbohydrates, then any fat or protein that you ingest is not going to be metabolized and it's going to go to storage. And so that is when obesity really goes on the rise. All right, how to breathe. How we breathe affects our pain in such a big way. This is probably actually the first thing I will look at with patients. And the first thing I will want to see is, can they effectively use their diaphragm when breathing? Because most patients, when I ask them to take a deep breath, will take a deep breath into their chest. They're not seeing any movement in their lower belly. So I do have a video on walking you through diaphragmatic breathing. And this is something very important. It's going to help re-regulate the nervous system, which is going to make it more conducive for you to heal your pain. Also, it's just going to help mobilize the lower body, the lumbar spine, get more flexibility through there. And it's going to take the pressure out of these accessory respiration muscles in the neck and shoulders that they can often get overworked just by how they're breathing. I had a patient come in yesterday who has struggled with chronic migraines, and I worked with her on and off for probably the past 5 years. She's such a fast responder to treatment now. I did treatment and this all opened up, and she took 3 deep breaths and they tightened up again. And so now we're really, really focusing on her breathing patterns. Other types of breathing are what we call 360 breathing. This is going to focus beyond the diaphragmatic breathing into getting an expansion through the rib cage out like this. Okay, this is going to really help with pain in the sides of the body. And then alternate nostril breathing, which you can look up, breathing in through the nose one way, plugging and breathing out, is going to really help with any sinus congestion that is going to create facial pain, any pain on the nerves like trigeminal neuralgia, and headaches, migraines, things like that. And we talked about how mindfulness is a really good way to get in touch with your body and understand where pain's coming from. And breath work is a good way to get mindfulness into your day-to-day life. Okay. So how we think about pain is also really important. Louise Hay, who was a pioneer in this, said the only thing we are ever dealing with is a thought, and thought can be changed. Most of the time when we are in pain, it's because we're responding to our thoughts about something. So I do see this in my clinic. I talked about the chronic shoulder pain patients who had unresolved grief. So the grief is sitting in the shoulder. So that had to be addressed. So sometimes the pain is not just about what we've done, it's about what we're thinking and what we're feeling. We have patients who have abdominal pain, cramps that they can't find any discernible medical cause for this. And Louise Hay would say, well, that's fear. You're stopping processes. And we know that fear is associated with the kidneys and the water element. And kidney, and even the biomedical kidney, can cause abdominal pain. Not having enough water can cause abdominal pain. And then also the stopping of processes. Well, a lot of times, if peristalsis or the movement of the intestines and the internal organs slows down, well, that's going to cause pain. So Louise Hay has a wide body of work on this. Of course, not all these beliefs are going to be the root cause of your pain, but I always think it's helpful if you get stuck in pain, or if your patients are getting stuck somewhere, to look at what could be associated with this and tap into that. Okay. And again, visualize yourself well. I have my patients have that visualization because it's an idea called quantum bridge. Once you have this idea of what you want and what you want to become, it's like you've already created that reality, and now you just have to come into alignment. Now it's easier to move toward it. And then lastly, how you eliminate. So we talked about constipation as being a problem for certain types of pain. We talked about water intake. So it's important to pay attention to these. And sometimes for some patients, it's not just the physical constipation, it can be emotional constipation. Sometimes they just have to let things go, and that releases a lot of tension and stress in their body. So here are some ideas for home care. We're coming up on an hour, so I wanted to go over some of these things and how to know when these things are going to work for you. Okay, so some things with acupressure, you can look up a lot of points on the internet, and you might not know, okay, how will I know that this point will really be helpful for my pain? So there's this idea in balance method acupuncture of mirror imaging. So mirroring effect says that the arm and the hand looks like the leg and the foot. So if I have thumb pain here, then I can look for a similar structure on my foot and massage there. And then while I'm moving my thumb, I should feel relief. Okay. Imaging would say that the trunk and the, I might have mixed this up. The trunk, the shoulders, if you cut your body in half, will be the same as your hips. So one I like for sciatica is because sciatica usually sits in around the hip low back area, is I'll go to the opposite shoulder and I might rub behind my shoulder or in front. So just looking for tender spots. Now, important thing to do when you're doing self-massage is you don't want to use little muscles. Okay, you want to use the leverage of bigger muscles. So what I would do is I'd hook in with my fingers here, and then I would move my arm to get that massage. Okay, so as I'm moving my arm here, then it's sending a signal to open up those channels, move my hips, and I should probably feel that sciatica go away or move. And then as it moves, this is not as tender. I go to another spot. Oh, now that spot's tender. So this is what we do a lot in acupuncture. Now you can do some of these concepts at home. Another thing to think about is if, say, you have this thumb pain, you can work on this thumb and you might feel relief for a little bit. But what you want to think about is, how did I get this thumb pain? Is it from doing this too much? Well, maybe I should have been using these muscles or these muscles, and maybe these are really tight, and so I've had to overuse this one. So you can look closer to the body and see, oh, here's a tender spot, and now I'm going to want to work on here, and now I can feel that the tension in my thumb is going away. So you want to look closer to the body, to the bigger muscles, and you also want to use those bigger muscles. So say you're opening a door knob, instead of doing this, you want to hold on and then twist with your shoulder. These are bigger, you can take a bigger load. Some popular herbs and supplements for pain. A lot of people have a question like, I tried this, it didn't work. Why didn't it work? Well, again, going back to the properties of food, different herbs and supplements, mostly herbs, are going to have different temperature and different effects in the body. So you want to familiarize yourself with that. You can look up those online, or you can get this book. It's called The Tao of Nutrition. It's a great reference book on food that you probably have in your kitchen already, and that you can use for a lot of different aches and pains or health conditions to help heal yourself. But for example, turmeric. Turmeric is very popular. I've seen it in capsules. I've seen people take it. I don't necessarily recommend turmeric for a lot of people because, number one, turmeric is very warm, so you want to use it moderately. Otherwise, it might be too hot for your digestion long term. Number two, and the doses that come in capsules are really high doses, and without any balancing effect, again, it can be too overwhelming for the system in the long term. So in Chinese medicine, it's a lot like cooking and baking. There are ratios, there are things that interact together. And you want to be mindful of that. But if say you want to use turmeric, it's just even better to just cook with it or to make a golden milk out of it, because when you have it in the capsule, say you have weak digestion, you have to digest the capsule first. So you might not even be getting the turmeric into your system and you're just getting expensive poop, right? So other supplements, magnesium, B12, vitamin D, glucosamine. Glucosamine is very, maybe not as popular. I don't hear about it as much, but some people still think about it for pain. Glucosamine, your body should make itself. So you shouldn't necessarily need an exogenous source or to be dependent on it, because you should have posture be able to fix the reason why the glucosamine is not present in the joint. Magnesium, very quickly, if you're going to get magnesium, it's going to help with muscle spasms and relaxation. You want magnesium citrate if you're going to take it internally. And if you really want faster relief, I recommend you get topical magnesium. And if you have chronic pain, you can put magnesium on your feet every night. But if you have a heart condition, make sure to ask your doctor about that first. B12, if you're vegan or you're vegetarian or you don't really eat red meat, you're probably lacking in vitamin B12. And so you're going to want to supplement with that, or just start eating meat if you can. But if you supplement, make sure it's a methylated version, because some people are not able to methylate anymore. And that's just a fancy way of saying able to take it apart to use as energy information. Vitamin D is often overlooked, but it has a very big effect on our pain, because vitamin D is actually tells us how much we're out in the outside world. Vitamin D is made in our body with sun exposure. And a lot of us are too insulated. We're not getting outside, or when we do get outside, we're wearing too much sunscreen. And so we're having to supplement. But there's more to sunshine as medicine than just vitamin D. So please download the D-Minder app, get your vitamin D levels checked. Your vitamin D levels should be dynamic. They are going to be lower in the winter, at the end of winter, and higher at the end of summer, fall. And you can use the D-Minder app to track that. It's very common for people to say, for doctors to say that a level 30 is fine for D. It's not. Maybe at the lowest point in February, March, it can be 30, but by the end of the summer, it should be closer to 70, 80, 90. Again, and then home health practice, mindfulness, meditation, tapping. These are all going to help get the body to you get more aware of what's going on in your body. Tapping is a great at-home treatment you can do. It's based on different acupuncture points that you will tap in succession. So you tap 6 to 7 times on a series of points, and you can look up what those points are and where they are. And it's going to disrupt that negative neurological pattern associated with your pain. So again, when you're seeking medical help, I've kind of gone over already. There's things to look for when you're working with a medical doctor and with a specialist. There are things they're great at. Please do not come to my clinic if you've broken your arm and there's bone showing. I don't want you in my clinic, okay? Please go to the emergency room. But there are cons to it, and not all MDs are the same. However, you have to think about how they're employed and how they're working. If they're in an insurance-based model, they're not going to give you as much time and attention as if you pay out of pocket and go to, say, a concierge doctor. But you can advocate for yourself. And that's what I do, a lot of consulting with patients. And online, I consult with people to how to get the most out of their medical care. Okay. And so likewise, when you're seeking help with an acupuncturist or a doctor of Chinese medicine, the benefit to going into an acupuncturist, and in California, I work as a primary care practitioner, is that not only are you going to get started on treatment and get a plan, but you're going to probably get relief that day. you're going to develop a relationship with me. I'm going to see you a lot more often than a medical doctor or PCP in that field would see you. So I'm going to become a partner in your long-term healthcare. Now, the cons of that, of working with an acupuncturist, is potentially that you're not going to get super fast results. Generally, now some people do get really good results right away, but you have to manage your expectations of thinking this is going to be a long-term solution to my problem. And then also, not all acupuncturists are trained in patient management. So they might not give you a treatment plan. They might give you a treatment, ask you how you feel, and say, well, okay, when do you want to come back? And you as the patient, you shouldn't be expected to know when to come back. Your practitioner, your doctor should have a plan for you. So if you find practitioners like that, be aware that's more about that person than the medicine. Okay, so when you're picking a provider, look for someone who is going to help guide you, have a plan for you, and manage your expectations. So that is the presentation. I'm 10 minutes over the hour. So if anyone has any questions, you can unmute yourself and share.
I have a question about your sleep patterns.
Yes.
If you are used to sleeping, let's say on your side, and you're trying to switch to your back, does that eventually become muscle memory? I do a lot of rolling during my sleep. And so I'm trying to change my sleep patterns, but I find myself, once I switch, I wake up in that bad position, if you will.
Yeah, that's really common. And one of the strategies I use is to bolster yourself. So find as many pillows as you can, put them on your side, even put a pillow or something heavy on your chest, because what we're looking for in the side position is that comfort of something touching our body. And that's what we'll look for. So on the back, it will feel like we're exposed, right? So at first you can use those bolsters around you to keep you in position, but to also help you feel comfortable. And then eventually, you're right, it'll just become muscle memory. You'll become a lot more used to sleeping like that.
Great, thank you. And then I just have one other question. On your YouTube channel, do you have information on meridian tracing?
No, I don't have a specific video right now on the 12 meridians, but you can do a Google search and you can see where all the different meridians are on the body. This is what a lot of balanced method acupuncturists do, is we try to find where the pain is and associate it with a certain meridian.
Great, thank you.
Thank you. Okay, does anyone else have a question? Okay. If not, well, that's it. Thank you all for joining. And the recording will be sent to you soon. If you have any questions after watching this, feel free to reach out to me and I will answer to the best of my ability. This was a lot of information. I could go a lot deeper into every part. So whatever you're most interested in, please let me know and I will go deeper into each subject. All right. Thank you so much and have a great day.
Thank you.